Hi, my name is Eugene Mwembo. The title of my presentation is Presentation of My Solution is Saskatchewan's Diabetes Care Innovation. My presentation outlines a proposed community-based program utilizing mobile clinic and telehealth services to improve diabetes prevention, management, and healthcare access in Saskatchewan, especially for rural and indigenous populations. I present an overview of the solution, its integration, what it addresses, the impact of health costs and outcomes, the implementation, effort and challenges, the stakeholders' engagement and capacity building, potential impact and strategic planning, the capacity constraints and the future actions, and finally, the stakeholder motivation and readiness. Our solution is a comprehensive program utilizing mobile clinics and telehealth, which aims to improve diabetes prevention, management, and healthcare access across Saskatchewan, especially for rural and indigenous populations. Mobile clinics and telehealth integration. Our solution enhances access to diabetes screening, education, and management services in underserved areas. It deploys mobile clinics to rural and remote regions. It provides on site screening, education, and management. It incorporates telehealth to connect patients with specialists like endocrinologists. It addresses challenges of limited health care access in rural areas. Finally, it facilitates early detection and intervention. Our solution is addressing healthcare disparities and vulnerable populations. It targets indigenous communities, seniors, and individuals with mobility challenges to reduce health disparities. First Nations adults have a diabetes prevalence rate 1.72 times higher than non indigenous adults. 70.5% of Saskatchewan's population is over 65 at higher risk for type 2 diabetes. Mobile clinics offer culturally sensitive care tailored to indigenous needs. Telehealth connects indigenous patients with specialists. Our solutions improves health outcomes and trust in healthcare systems. What about the impact on healthcare cost and outcomes? Our solutions aim to reduce long-term costs and improve health outcomes through early detection and management. Diabetes costs Saskatchewan healthcare system approximately 114 million annually, 2024 estimation. Early detection and management can prevent costly complications like kidney failure, amputations, and blindness. High impact on reducing mortality and complications, potential to lower healthcare costs and hospitalizations. It addresses the high prevalence rate of 29% of the population with diabetes. How will our solution be implemented? What are the implementation efforts and challenges? Our solution requires significant resources, infrastructure, and stakeholder engagement. There's high initial investment in vehicles, equipment, and stakeholder and digital infrastructure. It needs robust internet connectivity in rural areas. It demands recruitment, training, and cultural competency of healthcare staff. It involves community engagement, especially with indigenous groups. Challenges include logistical planning, funding, and technology adoption resistance. Effort level ranges from moderate to high with high impact potential. The stakeholder engagement and capacity building. Our solution involves governments, healthcare providers, indigenous communities, and advocacy groups. The government. The government needs to expand funding, personnel, and develop a comprehensive framework. Healthcare provider. They require more specialists, training, and telemedicine support. Indigenous communities, there's need targeted program, funding, and local workforce training. Diabetes Canada advocates for policy support and resource allocation. And stakeholders in general, they show high readiness and varying capacity levels, requiring coordinated effort. What is the potential impact and strategic planning? Our solution highlights high impact with moderate to high effort for successful implementation. It improves health outcomes, reduces complications, and extends healthier lives. It addresses 29% diabetes prevalence and high mortality rates. It creates long term savings by reducing costly treatment. It bridges healthcare access gaps for rural and indigenous populations. It demands infrastructure development, stakeholder collaboration, and sustainability planning. What about the capacity constraint and future actions? Our solution identify gaps in resources, workforce, and infrastructure. At the government level, the government needs more personnel, funding, and data system. The healthcare providers. For this, it requires expanded training and telehealth infrastructure. At the level of indigenous communities, there's need culturally tailored programs and local health workers. Actions points include training, resource investment, policy development, and community partnerships. Success depends on strong collaboration, funding, and the phased implementation. Finally, let's talk about stakeholder motivation and readiness. Our solutions accesses willingness and the capacity to support change. The government, there is high readiness, medium to high capacity. Healthcare providers, there's medium to high readiness, medium capacity. Indigenous communities, there is high readiness, low medium capacity. Diabetes Canada, high readiness, medium to high capacity. Overall, stakeholders are motivated but require capacity building and engagement effort. Thank you for having me. Thank you for your time. And thank you for allowing me to present my solution, my solution for Saskatchewan diabetes. Thank you.